Two issues. The issue about price control and what the drug companies can and cannot charge. I foresee a Supreme Court challenge to that as either restraint of trade and or that it's abridgment of right of free speech and or something else other than that. I see that as a real concern, which would happen in the States, but not here. The other thing that concerns me is the vitriol that is coming out of the right wing with regards to the whole issue of health care. And how are we dealing with it? I mean, I'm just astounded at the level of basically the hatred that's coming out of this. It's just really over the top.
Well, there's no doubt that the nastiness of the debate over the last month in particular, which you could see starting to shape up around the middle of July, took a lot of people by surprise. See, up until early July, I think all the political wise guys in the country were convinced the debate was over, that the progressives had won. Because you turn on the television, you read the newspapers, all there was more talk about what was wrong with the system and how it needed to be fixed. The mistake they made was that they underestimated the number of people who weren't paying attention. And it's quite clear that a majority of Americans were not paying attention. And into a void then got very quickly hurled some phantasmagorical views about what H.R. 3200 contained. You've all heard the silly claims, the death panels, the obligation for people to have abortions, the notion that the Secretary of Health is going to tell you what health care you can get and what health care you can't, right? And on and on and on. I mean, we get about, in the office, about 1,000 communications a day. Faxes, emails, mail, phone calls, people walking in the door. A substantial percentage of those now are made up of chain letters that are illusory. Right? I mean, they're based on an overheated imagination that lost all contact with reality about 600 years ago. The trouble with that is that it has had an impact on an awful lot of people. Now, and as you know, a number of members of the House and Senate have decided not to have town halls on health care over the last month. Pleased to be able to tell you that Eric Massa is not among them. He will have, by the end of the month, 13 or 14 town halls, including one 4 nights ago just south of Rochester that had a crowd of 1,500 people.
What kind of response did you get?
Well, it's hard to know because some of them weren't from the district, because he's the only, virtually the only congressman in upstate western part of New York who's having town halls. Either they don't feel they need to because they'll get reelected without them, or they're afraid to because they won't get reelected with them. A lot of them. Well, Eric is extraordinarily good at not letting anybody intimidate him. He is unintimidated. I guess you get that way if you spend 24 years in the Navy firing big guns, you know, bad guys. And he has been extremely fair in listening to everybody. His standard line is, hello, everybody gets to speak, but everybody else is going to let him speak. And I'm going to be here until the last question's been answered. Some of those town halls have lasted for 4.5 to 5 hours. But he has gotten, as a consequence, incredibly positive coverage in the newspaper. The White House calls me every 3 days to say, okay, how did it go last night? And each Congress member has a person in the White House that does that. They sort of keep track of how things are going. And I'm pleased to be able to tell my dear friend in the White House that we had a crowd of 700 people, had to move outside because the arena was too small, and that it was quite peaceful. We didn't have to call the police, though there were a lot of people yelling and screaming, but mostly the rest of the people sort of take care of them so that the police didn't have to.